Methods of documentation. Narrative charting. This is a traditional client record and it has 5 basic components. These are the admission sheet, physician's order sheet, medical history, nurse's notes, special records and reports. So narrative charting is flexible in nature and can be used in any clinical setting. Source-oriented charting. Different disciplines chart on separate forms and each reader must consult various parts of the record to get a complete picture. Example like nurse's record in the nurse's note and doctor's record in the physician note. They have their separate notes and this kind of records become bulky. Problem-oriented medical record. They use the format SOAP. S means subjective. That is whatever the patient tell, and objective means whatever you observe in the patient. And assessment. Assessment should be made based on the data obtained from the patient, and P means plan. So after making the assessment, plan the intervention which you are going to give to the patient. Pie charting. P stands for problem statement, I for intervention, and E for evaluation. Problem statement means suppose if a patient has a pain score of 7 by 10 on a scale of 0 to 10, then the intervention will be like to provide comfortable position or to give analgesic like paracetamol. And evaluation, after giving all the intervention, evaluate it and check whether the pain is reduced or not. Focus charting. DAR. D for data. Data may be subjective or objective data. And action. Action is similar to that intervention. And response. Here also let's talk about pain. So if the patient says that he's having a pain score of 6 by 10, so you can give analgesic like diclofenac, and after some time you can check the patient response like whether the pain is reduced or not. Charting by exception. In charting by exception, documents the nurses or the doctors documents only deviation from pre-established norms, document only abnormal or significant findings. Computerized documentation. These are the documentation made in the computer, and computerized documentation saves time and also improves the quality of document. Common record keeping forms are like admission nursing history form, flow sheets and graphic records, patient care summary,